Welcome friends, I am Dr. V.K. Chauhan, homeopathic physician. Revise with me homeopathic remedy Agaricus Muscarius. This is part 5, clinical correlation, and text is entirely taken from Allen's keynote, and this is a good revision to BHMS homeopathic students, interns and other professionals. So first, PQR is persons with light hair, skin and muscle relax. So it is a constitutional feature what Allen describes, and we can clinically correlate that people who are skinny, thin, slender, slim, lanky, flat-chested, light-muscled, weak, fragile, delicate and usually tall, they belong to the constitution known as ectomorphic somatotype. These individuals are prone to tubercular chest infection, and previously they were known as thiesical constitution. So about this particular characteristics, in case of Agaricus muscarius, Borix, if we see the Boric materia medica, he tells us about incipient thiasis is related to tubercular diathesis. So more or less we can understand that Agaricus muscarius has a tubercular diathesis. Second PQR is drunkards, especially for their headaches, bad effects after a debauch. So after alcoholism or good amount of alcohol somebody takes at night, early morning he gets up with the headache, and such alcoholic headache is known as hangover, and it is usually caused by overconsumption of alcohol, and it presents as headache, feeling sick, dizzy, sleepy, confused, thirsty, nausea, and patient may be sensitive to light, and he has been feeling of exhaustion or feeling that he is having lot of fatigue. The next PQR is delirium. With constant raving, tries to get out of bed in typhoid or typhus. Here in this case, we are talking about typhoid delirium, and delirium is a neuropsychiatric manifestation of typhoid fever. It is a toxic confusional state characterized by disorientation, restlessness, and it is characteristic of late stage typhoid fever, maybe second stage or unfavorable third stage, where the patient is toxic and he is in a serious state. The next PQR is chilblains that itch and burn intolerably, frostbite, and all consequences of exposure to cold, especially in the face. There is burning, itching, redness of various parts, ears, nose, face, hands and feet. Parts are swollen and hot. This is a part of exposed skin to cold where we have features of frostbite. So clinical correlation is chilblains are the painful inflammation of small blood vessels in the skin that occurs in response to repeated exposure to cold but not freezing air. Chilblain can cause itching, red patches, swelling and blistering. The next PQR is involuntary movements while awake, seizures during sleep, chorea, from simple motions and jerks of single muscles to dancing of whole body, trembling of whole body, twitchings of muscles of face. Please refer to Mygale. Similarity of complaints we have here. Persons subject to chorea, twitchings or grimaces from spinal affections. However, clinically, we can correlate this condition as caused by underactivity of neurotransmitter dopamine in the areas of brain that control movement. And there are subcortical nuclei which are affected acutely or in chronic cases. Acute affection is Sydenham's chorea or rheumatic chorea, and chronic condition is where it can be a hereditary disease, or we have Wilson's disease. Over there also you will find the similar symptoms. Somewhat similar symptoms we can also encounter in cases of Parkinson's disease. The choreiform movements are the grass movements, but twitching and you can say trembling is classically you will find in cases of especially like Parkinson's disease. We are continuing with the chorea. Let us see what are the causes of chorea. Iatrogenic causes, drugs, especially levodopa, oral contraceptive pills, psychiatric drugs are there. Vascular diseases of basal ganglia, they include atheroma formation, old age, SLE, and degenerative diseases, say for example Huntington's disease, and post-infection like Sydenham's chorea, and others they include thyrotoxicosis where you will find tremors, but these are the sympathetic overactivity. The next PQR is uncertainty in walking, stumbles over everything in the way, heels pain as if bitten when standing. This particular PQR has got two components. Number one component is ataxia. You will see for a moment such complaint in acute toxic state with alcohol, and in chronic cases also alcoholic cerebellar degeneration is well known fact. It is more common in males than females, and there is selective involvement of superior cerebellar vermis, which is a common occurrence in alcoholic cerebellar degeneration. It produces exclusively or primary ataxia of trunk and lower extremities. Gait is unsteady, ataxic gait is there. And second component was heels pain as if bitten when standing. And here what we find, it is points to tender heel pad, and it is due to plantar fasciitis. Plantar fasciitis occurs when somebody carries too much of load on his shoulders like laborers, and that over burden injury results to the plantar fascia ligament, and causes pain and stiffness. The main symptom of heel pad syndrome is a deep pain or tenderness in the middle of heel, especially while standing or walking. The next PQR is the sensation as if eyes touched or ice cold needles were piercing the skin as from hot needles. So clinical correlation is, it is a allodynia. Allodynia is characterized by pain from non-painful stimuli. Just for example, a person may feel pain from light touch. The main symptom of allodynia is pain from non-painful stimuli, where you will find severe pain even from a few hair brushings against their skin. Symptoms can vary from mild to severe. Some people may feel burning sensation while others feel an ache or squeezing pain. The next PQR we have is spine sensitive to touch. Worse, morning pain is sore, aching in lumbar and sacral region. During exertion in the daytime, while sitting, every motion, every turn of body causes pain in the spine. Single vertebra is sensitive to touch. We have low backache, we have muscles, we have lot of muscles in the back, erector spinae, latissimus dorsi, quadratus lumborum, and then we have vertebral column. There are certain changes with age, osteoarthritic changes which you will find in case of old age. And erector spinae ligament, these are going to have some affection, and these muscles may cause easy straining, and lumbar pain is most common cause of low back pain. Muscle strain usually occurs when the muscles of back are abnormally stretched, and common bone problem is lumbar spondylosis. The next PQR or red line symptom in Ellen's is prolapsus post-climacteric, bearing down pain, almost intolerable, and it is extremely sensitive to cold air. So female who is in his menopausal age group, probably she has born many kids during her reproductive age, and that causes the pelvic viscera cannot be kept in position because pelvic diaphragm is loose, and that causes prolapse uterus. And as we know that it is due to weak pelvic muscles and ligament. And also we can again recall multiple pregnancies and vaginal deliveries are more common causes. Other conditions could include like constipation with a habit of frequent straining to pass a stool and chronic cough. Obesity can also strain the pelvic muscles, please remember. The next red line symptom is the complaints appear diagonally, upper left and lower right side. And we have similar symptoms in antimonium tart and stramonium. And then we find upper right and lower left in ambra, bromium, medurinum, phosphorus, sulfuric acid. So here we can clinically see this is a classical presentation in Weber syndrome, where we have got occlusion of the perforating branch of posterior cerebral artery is only in this way a perfect example. We have, this is the particular area in the diagram which is depicting anteromedial damage to the crura of midbrain at the level of red nucleus. There is ipsilateral third nerve palsy is there and contralateral hemiplegia. The diagonal complaint, again we will remind ourselves, Weber syndrome, also known as superior alternating hemiplegia, is a form of stroke characterized by presence of ipsilateral oculomotor nerve palsy. Ipsilateral, the same side where the damage is present, that cranial nerve is affected, third cranial nerve, and contralateral hemiplesis, upper limb and lower limbs are affected on the opposite side. So this is the diagrammatic representation of the lesion and eye changes because third oculomotor nerve, there is an unopposed action. Medial rectus is not being able to work properly because third cranial nerve supplies it. So the eyeball is in the lateral position and downward position. So let us see the clinical correlation. Weber syndrome, also known as midbrain strokes or syndrome or Superior alternating hemiplegia is a form of stroke that affects the medial portion of midbrain. And again, we'll revise once more. It involves oculomotor fascia, fasciculus in the interpeduncular cistern and cerebral peduncle, so that it characterizes the presence of an ipsilateral, or you can say lower motor neuron paralysis of oculomotor nerve, and contralateral paralysis or hemiplegia, which is upper motor neuron type on the opposite side. So thank you very much for patient listening.